When it comes to your vagina, the last thing you want is cause for concern. But vaginal discharge can be alarming, especially if you don't usually experience it. Vaginal discharge happens when your uterus, cervix, and vagina discard old fluid and cells. Some discharge is totally normal and healthy, just your body's way of cleaning itself out. Normal discharge ranges from clear to white. Its texture may vary too. But sometimes your discharge can signify a health concern. Its color, texture, and consistency are important clues that can help your doctor figure out what's going on. 3 of the most common causes of unusual discharge are ovulation, yeast infection, and bacterial vaginosis. But how can you tell which is which? Let's break them down. Clear discharge is usually a sign that you're in the ovulation phase of your menstrual cycle. It may be sticky or stringy. It's common for discharge to change color and consistency throughout your menstrual cycle. When you're ovulating, it becomes clear and gummy, the texture of an egg white. This kind of discharge is usually nothing to worry about. It's just a normal bodily response to your menstrual cycle. But there's one kind of white discharge that indicates that something is wrong. If your discharge is white, but is thick and cottage cheese-like in texture, it could be a sign of a yeast infection. And it's often accompanied by vaginal itching, irritation, and burning. Yeast infection discharge can also sometimes have a yellow or light green color. A yeast infection happens when natural yeast found in the vagina begins to overgrow and cause an imbalance. The good news? Yeast infections can be cleared up with a simple over-the-counter cream or a prescription from your doctor. But what if your discharge suddenly isn't white or clear at all? If it starts to look gray, that's another sign that something isn't quite right. Gray discharge is one of the telltale signs of bacterial vaginosis, a common condition that happens when some of the normal bacteria in your vagina overgrows. This causes an imbalance that leads to an increase in vaginal discharge. It's usually gray, thin, and has a fishy odor, and it's most noticeable after sex or around your period. As with yeast infections, prescription pills or vaginal ointments can quickly and effectively clear up bacterial vaginosis. These are the most common conditions that affect your vaginal discharge, but they're not the only ones. Other health issues can turn your discharge colors like pink, red, brown, yellow, and green. So don't ignore strange discharge down there. Pay attention and always check with your doctor. They can determine whether it's normal or if it needs treatment, and then they can help get you and your discharge healthy again.